Shore Healthcare delivers care on behalf of local authorities, on behalf of NHS trusts. We deliver care throughout the UK across a wide spectrum of provision. We're very proud of our Welsh specialist services. They are very special services. They're very different services as well. We're across South Wales to Pembrokeshire, Carmarthenshire, Cardiff, up the valleys. A number of them are very close together, which works really well because you can share good values, good lessons, you can share staff between, even residents visit different services. Some of the homes may team up to do group activities in a local area. There's a big sharing of knowledge across the specialist services in Wales to support each other. We're able to recommend other services, so should people progress within their mental health, there are other services that we can support people with, so they're still within the Shore family on their journey.
Each service has its own identity and its own purpose. None of our services are the same. The type of people that we are supporting are people who've got an enduring mental illness. We look to support people to maximise their independence in every service to their best ability to be living their best lives. We aim to try and cover a plethora of step-down services, so we're aiming to bring people through their journey and their care pathway. So we may have somebody that would go into Cwmcelyn, which is more specialist mental health nursing, with the aim then to step down into Mysetherwyn, which is more mental health nursing, rehab focused, where we have occupational therapists and we focus a lot more on the psychosocial well-being of people's journey. And then hopefully from there we would step down into a T-Bringolai service, which is 27 self-contained flats whereby people have their own tenancies, they have their own front doors, their own letterboxes. It's as independent as possible for that person with a person-centred care package, and then hopefully from there step down into the community.
We provide a safe place for people with severe and enduring mental illnesses to flourish into who they need to be and who they want to be without the overarching fear that detainment tends to do for people with mental illness, and we do a very good job of keeping them out of hospital. We have 4 units divided into 6 beds, so that everybody has their own room, but we have communal areas. Every unit has their own cooker, has their own washing machines, to encourage people to be as independent as possible and rebuild those skills essential to moving back into independent living in the community. We are a hands-off service, which means we have no restraint in our service at all, which means we have to work on building therapeutic relationships with our service users. We have to develop that trust for them to become the best versions of themselves they can possibly be.
And lots of friends, yeah. And I got special ones as well. The staff likes to me, and the staff treat me with respect. Sometimes we need a bit of help. Then you go shopping. I have bingo. Quiz. We've got our own flats with 1 bedroom and shower room and kitchen and 1 lounge. And I love it.
Independence is one of the most important things at T-Bringolai. It's about empowering service users to be equipped to live in the community successfully. Even though all residents have their own accommodation, have their own flats, their own homes, we still have communal areas so people can socialise, and they are neighbours in their own community. The relationships are so important to them. The staff and the other residents do become their family. We link in with Cwmcelyn and Mysetherwyn. We work together to accommodate clients as best as we can. Even though it is sad to see residents move on, we do have success stories and achieve a home in the community, a family in the community.
Well, for a start, it's a very nice house. I've been here over 15 years, more or less. I love taking care of all the tenants. Being with all the staff is very comfortable with my mind and psychiatry problems. Having good friends around me, tell each other our problems. I actually do feel very safe in this house here. Well, it's a house from heaven, really.
In T-Bringolai in particular, we are just there with a support package in place to help them on the way and make sure that we have everything in place to make this the best opportunity for them to succeed. We encourage people to go out, as we would in the community, going back into work and have access to those services which they are also entitled to have.
I love this job. I've done it for 10 years. I was working so hard done a good job. And then they put me in the office and said, Glenn, well, would you like to have a job here? Makes me happy, and I do my job, I clean up, go home, and I'm happy about it.
It's mostly about what we actually do here and encouraging people to live their best life. It's about people being happy. I think the key here is our team. We've got staff here that have worked here since day one, and that's 34 years. These faces are here most days of the week. We are family. We know the ins and outs. We know their history. We know what makes them tick. Trust is the key. We work in both homes, but I think it's good to work together and we bounce ideas off each other. So it makes our care plans and our whole approach very, very person-centred. It's so important for somebody to live a fulfilling life, but as well to have that motivation to gain skills again that they've lost on the ward, and just to reduce that revolving patient and not to go back into hospital so often. And it's working.
We are a 24-bedded service that provide support for service users with learning disabilities, enduring mental health needs or EMI dementia. We found that as people with mental health, they're more likely to develop dementia, so we wanted to be able to provide them with a home for life. By being able to give them whole of life care, they don't have that distress of having to move on to a different placement. We have RGNs and we also have RMNs, and I find that collaborative working works really, really well because we're not just looking after their mental health, we're also looking after their physical health. And our support workers come from a broad range of experience. That blend of the skill mix really, really works well for us. We've got a very good, strong ethic of care here and of community. Anything that service user needs, if they're able to do it, they will. It's come a very long way, and the old idea of how homes used to be for people with mental health is very different.
It doesn't feel like a nursing home, it feels like your home. We had such a lovely warm welcome when we arrived. The trust was built really quickly. I trust them completely. It's like an extension of the family. Being here is improving his quality of life because the time I get to spend with him is precious quality time. They don't just look at the illness, they look at the actual person and what their needs are. And of course the needs change and they change with them. They love and care for each and every one of the people, you know.
It's really important that we establish good working relationships with our commissioners, keeping them up to date with any vacancies or any new plans that we have. We inform those commissioners to ensure that they are happy with the services that we are providing. We work extremely hard to ensure that we are meeting the criteria of the Wales frameworks. Wellness, happiness and kindness are our core values, and it is embedded in everything that we do every day. And that's not just supporting the people that live with us, that's supporting our staff. It even extends to supporting families. We've got very kind, caring staff that go above and beyond in their jobs every day for the individuals. We see the impact on people daily, you know, we see their smiles, their laughter. If they're happy, smiling, they look well, they're eating well, they're getting out and about, that's an indicator of success. We can put packages in place in the community that can support people who are quite unwell. It's working, we see it at Tibringoli, it does work. That shines through in everything that we do.
The really nice thing about the specialist services is they're just wonderful places to visit. Everybody knows everybody. The staff are super proud to work for Shaw. We're the largest employer-owned healthcare company in the UK. The services are very interesting. They're wonderful services and we look after wonderful people.